Hi, Mr. Malone. My name's Lauren. I'm a CNA, and I'm going to be getting you ready for today. So I have closed the curtain, and I have washed my hands and set up all my supplies. So we are going to give you a bath. So I'm going to take this down. You need your glasses off. Everything is all ready. I have warm water here. You tell me, put your hand in there and tell me if that's feels good. Yeah? Okay. Yeah, you can. Okay, I'm gonna put some gloves on.
Did they say I can't use my hands? Don't you have to look at my hands?
No, you just can't. Okay, so I have my warm water here. I have a towel for washing and a towel for rinsing, and then I have my drying towel here. So I'm going to put this over you so I don't get your clothes wet. And then I'm going to wash his face without soap. Okay, just tilt your head back a little bit.
You should do this every day.
Alright, so now that we've washed his face without soap, I'm going to wash his arm. Go ahead and put your arm up here. Okay. So this towel has soap on it. I'm going to wash his arm like this. Then I'm going to wash the armpit. And then I'm going to wash his hand.
You're good.
Alright, so now I'm going to take the rinse towel and rinse his arm and armpit. And hand. Now that he's all rinsed, I will take this towel and pat dry. And use a different portion and pat dry your face, tilt your head back. Okay, make sure his hand is all dry. Alright, and he is all dry. I'm going to remove the soiled towel and put it in the laundry. And then, now that his bed bath is complete, I will rinse this basin, rinse out the towels, and clean and dry, so that's all done. And then I'm gonna put his call light by him, and I'm going to light lock and low, so I'm going to lower the bed. I'm going to make sure the sides aren't up, and make sure he knows that he can press his call light if he needs us, and I will cover him back up in his position of comfort. Alright. And dispose of my gloves. And I will sanitize my hands and sanitize all my equipment and the surfaces that I have used. Alright, Mr. Malone, now that we have cleaned your body with the bed bath, we're not going to brush your teeth and get you ready to eat breakfast, okay? So I have all my supplies ready. I have washed my hands. I have a towel in which I'm going to drape over him to keep him from getting wet from the water and the toothpaste. And then now that I have all my supplies gathered, I'm going to put my gloves on. So drape this over him and put my gloves on. toothbrush, put toothpaste on it, and I'm going to have him open his mouth. I'm going to brush the bottom of the teeth, sides, the front, and all of this is in a circular motion. Alright, so I'm brushing the right side and the top of his molars, and the left side and the top and the front. Okay, now I'm going to do the top. So back left molars of the top, front, and the back right. And now I'm going to do the tops. So you do the front, and the side. Alright. Been about 2 minutes of brushing. Now I'm going to do his tongue, so stick out your tongue. Alright, now that I brushed his teeth, I will give him some water to rinse his mouth. And he's going to spit in the basin. Alright, now that he's done doing that, I will wipe his face off with a clean part of the towel. Feel good? No toothpaste left in your mouth? Good. Alright, teeth look clean. Alright, so now that I'm done brushing his teeth and I've verbalized all the surfaces and done his tongue, he has rinsed his mouth, I'm going to remove the soiled chest barrier and put it in the laundry. And I will empty the basin, rinse it, and I have dried it. That's all done. Rinse the toothbrush and put my supplies back in the supply closet. And then once I'm done doing that, I will remove my gloves by turning them inside out and keep the resident in a position of comfort. Make sure he's covered up, warm, doesn't need anything. Put his call light next to him. I will light lock and low, which is lower the bed. Make sure it's not locked, or make sure it doesn't move, but that the sides aren't locked, and make sure he knows that he has his call light. So that's it for today for that, and then we're gonna get you to eat breakfast next.
How do you get used to this?
Alright, Mr. Malone, I am back with some food for breakfast today, and I have looked at your care plan and seen that you don't have a special diet, you're not diabetic or anything. Can you tell me your name?
Riley Malone.
Okay, so that matches the name on the care plan, so I know I have the right patient. And I have gathered all my supplies and washed my hands. I'm going to place a barrier here and wash his hands. Alright, so I need your hands. Just like that, there we go. Just gonna wash them up here. There, now your hands are clean too. Okay, I have some hand sanitizer and he is ready to eat food now. So today I have yogurt and Cheerios and strawberries right here. So I usually would have a tray here. So I'm going to feed him.
Not gonna use the choo-choo train method?
No. No water? Okay. Got some strawberries. You want more yogurt? Okay.
full now.
Okay. So he said he's full. So I would say he ate about 25% of his food because he only ate a couple bites of yogurt, some Cheerios, and strawberries. So I would record that on his intake. And then I would also record on the INO sheet that he took in about, I'd say 5 milliliters of water. And I will make sure I wipe his face for him. And a little more water. Okay. Okay. So I've done that, and now that I have recorded how much he took in food, and then the milliliters of fluid that he took in, which was that 5 of water, on his sheet, then I will make sure to lower his bed back down to a position of comfort and leave his call light near him, which is right here. I'll take this from you now that we're done washing your hands and cover you back up. And then now that you have your call light, bed is light, lock, and load. Is there anything else you need before I go, Mr. Malone?
Nope. Cold beer would be nice next time though.
Alright, so now I have hand sanitized all surfaces and cleaned up my supplies, and he is good to go for the day.